Cisnero, 5 minutes.
Thank you, Madam Chair. Thank you to all our witnesses who are here today, and I really do appreciate you coming and speaking on this matter. Care for our women veterans and the specific obstacles they face that may impact their pathways and willingness to seek out VA treatment is of utmost importance to me, being a veteran myself, especially as it relates to intimate partner violence. Director Elam, in your testimony, you mentioned some research that the VA researchers are becoming increasingly aware of the rise of women veteran patients who are survivors of intimate partner violence. And in fact, emerging research has proved that women veterans are at a greater risk for intimate partner violence than their non-veteran women. Could you elaborate on this specific research, the data that was found, and why you think they found that data?
Well, I think one thing that VA research has really shown, I mean, they've done more research over a short period of time, like almost in a 7 or 8 year period than they had done in 25 years. So they're really learning a lot about this population. And VA has always been forward thinking in terms of asking questions when veterans come in. They're looking to make sure that they have the services available if someone is homeless, if someone has experienced trauma of some sort. And their findings are really, I think, showing that we need to, pay attention, be looking for these types of things. What are the specifics within this population that seem to be put veterans more at risk, that can help for prevention and can help moving forward in terms of addressing the issues? So I think researchers are on the forefront and part of that whole aspect that really make VA unique and special, and they need to make sure that they continue that line to really be working with veterans.
And well, now, do you have any recommendations? And it's good that you said the VA is good out there and asking the questions, but what could they do, and what also could Congress do to kind of help along with that process to make it better?
Well, I think they need to make sure that once they've asked the question, what are the programs and services that these women veterans need to address that issue, to make sure that they have the mental health services, to make sure they have the support services around that. So turning that into action is the most critical thing. Once they've asked the question, what can we do to make sure we support this veteran?
So you raise another issue, actually, that I was going to bring up as well. It's also troubling that women veterans who have experienced intimate partner violence place them at risk for developing certain mental health conditions and substance use disorder, increasing their risk of suicide. What would you recommend are appropriate outreach programs and efforts to support women veterans that are impacted by intimate partner violence?
Well, I think some of the organizations here at the table really also have some great, an opportunity and for a really important role to play, I think, like Brigitte McCoy and others who have a support system and have an outreach that's beyond the VA arm. I mean, this is one thing that we know is often women veterans don't have they're not connected with the VA, or they're not connected with the VSO community where they might not readily know about the resources that are available. So it's important to engage organizations that are here. This is everyone's issue, and I think that will be a critical piece in moving forward.
Does any other members have any comments to this on how we can address this issue?
So I think one of the bigger problems with related to this topic is that there will be a large group of women who will not perceive themselves as being victims of domestic violence. Having clear presentation of the awareness, being able to describe what domestic violence includes, because it's, to me, similar to military sexual trauma. There are a lot of people who say they didn't experience it until you start describing what it is and what it includes. And so that's one big part of the outreach. The other part, because WVSJ has been instrumental in connecting groups of women within certain demographics, social media, although some people think it's the devil, it actually, we've been able to, extract people from situations where it was unsafe because we had an integrated network of peer support, online, crowdsourced, intervene on behalf of a woman veteran. So there are ways to implement those things and keep the person safe and protect their identity as well.
All right, well, thank you for your answers. My time has expired.